If you're over 50 and you've noticed changes in your body, maybe your drive has slowed down, your energy feels lower, or you've simply stopped thinking about certain parts of your health, this message is for you. I want to talk about something that a lot of men quietly experience but rarely ever bring up. It's not a topic that comes up at family dinners or even among close friends, yet it plays a major role in your comfort, your confidence, and even your long-term well-being. I'm talking about how the body's natural release processes change with age and what that means for your prostate health. Because ignoring this aspect of your body doesn't just affect one area. It influences your hormones, your circulation, your mood, and how you feel every single day. Now, before we get too deep into this, let's set one thing straight. This conversation isn't about performance or comparison. It's not about how often anyone does something or how things used to be 20 years ago. It's about understanding how your body works, what changes naturally with age, and how to keep those systems running smoothly, because you deserve to feel good, energetic, and comfortable in your body no matter your age. Most men start noticing changes sometime in their 50s or 60s. Energy dips a bit. Recovery after exercise takes longer. Sometimes sleep isn't as restful. You might notice that your libido, your natural desire, isn't as strong, or that things take a little longer to get moving. That's all normal. Testosterone levels, the hormone that fuels energy, muscle strength, and reproductive function, gradually decline after the age of 40. The average drop is about 1% per year, but what's less talked about is how this affects the prostate. The prostate is a small gland that sits just below your bladder. It's about the size of a walnut, but don't let that fool you. It does an important job. Its main role is to produce a special kind of fluid that helps nourish and transport sperm. This fluid is part of what makes up semen. Even when sexual activity decreases with age, the prostate continues to make that fluid. It doesn't simply shut down. So, if the body isn't regularly clearing it, that fluid can stagnate over time. And that's when discomfort or inflammation can begin. Aging itself can also lead to changes in the size and shape of the prostate. For many men, it starts to enlarge slightly with time, a condition called benign prostatic hyperplasia, or BPH. This can lead to symptoms like frequent urination, weak flow, or that annoying feeling that you just can't fully empty your bladder. While BPH is not cancerous, and it's extremely common, maintaining prostate circulation and function is one of the best ways to reduce symptoms or delay their onset. Now, I want to pause and ask you something. When was the last time you thought about your prostate health? Most men never do until something feels off. Maybe it's those nighttime bathroom trips. Maybe it's that subtle pressure or slow stream. But your prostate is a living part of your body that thrives on movement, good blood flow, and balance. Research has shown that regular physical activity, healthy nutrition, and yes, regular release of prostate fluid all support better prostate health. The reason is simple. The body's natural systems were designed for rhythm and flow. When those systems slow down or stop, buildup can lead to inflammation or congestion. Let's talk about what healthy release really means, because it doesn't have to involve sexual activity at all. For some men, nocturnal emissions, also known as nighttime release, still occur occasionally and help maintain that rhythm. For others, prostate massage, performed by a trained medical provider, or even just staying physically active, can encourage healthy circulation. What matters most is that the gland doesn't remain stagnant for years on end. So, what are the signs that your prostate may be needing some extra attention? Common ones include difficulty starting or stopping urination, waking up at night to use the bathroom, feeling of pressure or heaviness in the lower pelvis, and sometimes even lower back or groin discomfort. These are not things to be embarrassed about. They're early signals from your body asking for care. When patients come to me, and we start discussing these symptoms, many are surprised to learn how lifestyle-driven prostate health really is. Let's explore a few core habits that make a real difference. First, movement. Gentle exercise is one of the most effective natural ways to support prostate circulation. You don't need to spend hours in the gym. Regular walking, light jogging, or swimming for 30 minutes most days of the week is enough to keep blood moving through the pelvis. That blood flow helps carry oxygen and nutrients to the prostate tissue and remove waste products that can contribute to swelling. Second, pelvic floor exercises, often called Kegels. Many men assume these are just for women, but they're equally important for male urinary and sexual health. To try them, simply tighten the muscles you'd use to stop urinating midstream. Hold for 5 seconds, then relax. Repeat this 10 times, several times a day. Over time, you'll strengthen the muscles that support your bladder and prostate, improve urinary control, and enhance circulation. Third, let's look at diet. The prostate is sensitive to inflammation, and what you eat plays a major role in that. Focus on foods that reduce inflammation. Tomatoes, especially cooked ones, are rich in lycopene, a compound that protects prostate cells. Pumpkin seeds are full of zinc, a mineral essential for prostate tissue repair. Salmon and other fatty fish provide omega-3 fatty acids, which reduce inflammation throughout the body. Green tea, rich in antioxidants, also helps reduce oxidative stress in the prostate. Try to minimize processed foods, sugary snacks, and excessive alcohol, which can contribute to inflammation and hormone imbalance. Caffeine can also irritate the bladder, so if you're getting up multiple times at night, cutting back on coffee or switching to herbal tea in the afternoon might make a big difference. Hydration matters too. Staying well hydrated helps flush the urinary tract and maintain a healthy balance of fluids. But here's a tip many of my patients find helpful: drink plenty of water during the day, but reduce your intake 2 to 3 hours before bed. That way, you support your bladder during the day without overloading it at night. Let's talk about stress for a moment. Chronic stress doesn't just live in your mind, it manifests in your body. When you're under constant pressure, whether it's work, finances, or family, your body releases stress hormones like cortisol. Over time, elevated cortisol can suppress testosterone, contribute to fatigue, and increase inflammation, including in the prostate. Simple mindfulness habits can counteract this. Try 5 minutes of slow breathing in the morning, or take a quiet walk after dinner without your phone. The goal isn't perfection, it's consistency. I often remind my patients that emotional well-being is just as important as physical health. Many men, especially after 50, begin to feel disconnected from their partners, their bodies, and their sense of purpose. Reconnection starts with self-awareness. The more you understand how your body works, the easier it is to take care of it. And here's a crucial truth: the prostate responds to balance. You don't need extreme changes or expensive supplements. You need routine, a rhythm that keeps things moving. That rhythm includes staying active, eating right, staying hydrated, managing stress, and yes, allowing the body to function as it was designed. I want you to think of your prostate as a muscle. When it's regularly used, nourished, and given good circulation, it stays healthy. When it's neglected, things tighten, stiffen, and stagnate, and that stagnation can lead to the very symptoms most men want to avoid. If you've reached a stage where sexual activity isn't as frequent, that's okay. There are still plenty of ways to support healthy release and circulation. Gentle stretches like yoga or pelvic tilts, deep breathing exercises, and even occasional medical prostate evaluations help maintain that function. Some men benefit from seeing a pelvic floor therapist who can teach relaxation and strengthening techniques tailored to you. Now, let's talk a little bit about frequency. The question everyone wonders about but rarely asks. There's no one-size-fits-all number. What research shows is that men who ejaculate more regularly, say 4 to 7 times a month or more, tend to have lower risks of prostate issues compared to those who rarely do. But remember, this isn't a prescription. It's about listening to your own body. If your natural rhythm feels balanced and you're healthy, that's what matters most. If you haven't been sexually active for a long time, don't panic. The body can adapt beautifully. Focus first on lifestyle, movement, nutrition, hydration, stress relief. These alone can restore energy, improve circulation, and naturally reawaken function. Sometimes, these changes even bring back libido naturally. Let's take a quick moment to talk about hormones, because they tie everything together. Testosterone plays a role not just in sexual function, but in muscle strength, mood, and mental clarity. As levels decline, the balance between testosterone and estrogen can shift, and that imbalance can contribute to prostate growth. Strength training, healthy fats, and maintaining a healthy weight can help optimize your natural testosterone production. Even 20 minutes of moderate exercise a few times a week can make a difference. You might be wondering if supplements help. There are a few natural options that show evidence. Saw palmetto, pygeum, and beta-sitosterol have been studied for supporting urinary flow and reducing inflammation. However, they work best when paired with good lifestyle habits, not as quick fixes. Always check with your doctor before starting any supplement, especially if you're on medication. Another important point: your urinary habits tell a story. If you notice changes, weak stream, dribbling, frequent nighttime urination, or discomfort, don't ignore them. These may be signs of BPH or prostatitis, both treatable conditions. Getting checked early can prevent complications and help you regain comfort sooner. Now, here's something that surprises many men. Ejaculation isn't just about release. It's also linked to heart health. The same blood vessels that supply the prostate and penis are closely connected to cardiovascular function. So, if you're experiencing difficulties in that area, it can sometimes be an early sign of circulatory problems. Improving one often improves the other. That's why I always encourage my patients to view reproductive health as part of overall well-being, not as something separate or embarrassing. Let me ask you this. When was the last time you did something just for your health? Not for work, not for others, but for you. Maybe it's time to start walking every morning again. Maybe it's replacing that second cup of coffee with green tea. Maybe it's finally booking that health check you've been putting off. Small steps add up faster than you think. I know this topic can feel awkward. Many men feel uncertain discussing these changes, even with their doctors. But silence is one of the biggest barriers to healthy aging. There's strength in being proactive, in saying, this matters to me and I want to take care of it. If you're watching this and thinking, that sounds like me, take it as an invitation to reconnect with your body. Your health journey doesn't end at 50. In fact, it's often just beginning, because now you have the wisdom to pair with action. Imagine waking up with more energy, sleeping through the night without interruptions, and feeling comfortable and confident again. That's not wishful thinking. That's what happens when you give your prostate, your hormones, and your circulation the attention they deserve. I always remind my viewers and patients alike, your body is incredibly adaptive. Even if you've spent years not thinking about your prostate health, it's never too late to start. The prostate, like any organ, responds positively to better habits almost immediately. Within weeks of improving diet, exercise, and stress management, men often report fewer nighttime trips to the bathroom, better flow, and renewed vitality. So, I want to leave you with this idea that maintaining regular release in whatever form is healthy for you is part of keeping your body's natural rhythm alive. Combine that with good nutrition, exercise, hydration, and emotional balance, and you have a recipe for not just longevity but quality of life. If you found this helpful, remember, share it with someone who might benefit. You'd be surprised how many men quietly struggle with these same issues, simply because no one talks about them. Starting the conversation can make a world of difference. And most importantly, make the decision today to take ownership of your prostate health. Schedule that checkup, start moving more, eat foods that heal rather than inflame, and make time for rest and relaxation. Your body will thank you.